Good morning, sir.
Good morning.
Good morning, everyone. My name is Simon Tetsua. I'm here to present my seminar on the topic Pharmacotherapy of Respiratory Disease, focused on asthma and conjunction obstructive pulmonary disease. Let's look at introduction aspects of the work. Pharmacotherapy of respiratory disease, asthma and cold. Respiratory disease such as asthma and chronic obstructive pulmonary disease are prevalent chronic conditions that require a comprehensive pharmacological approach to management. Pharmacotherapy aims to alleviate symptoms, prevent exacerbations, and improve overall quality of life. What are you trying to say here? Respiratory disease is a disease that affects thousands of people, and is a disease that needs a comprehensive approach in management, treatment, and even researchers can do their research to come to the eradication of this disease. It will be very important because it affects thousands of people. So it needs a comprehensive approach in management or treatment as well. So pharmacotherapy is aimed at alleviating symptoms to prevent exacerbations and improve overall quality of life. Although both conditions affect the respiratory system, they differ in pathophysiology, leading to variation in treatment strategy. Yeah, if you look at the chronic obstructive pulmonary disease, it differs. The way it affects the respiratory system is different from asthma. So respiratory disease encompasses a broad categories of disorder affecting the airway, lungs, and other structure involving in breathing. They range from acute infection to chronic inflammatory condition. This respiratory system starts from acute to chronic stage. So when care is not taken from acute stage, it will exceed to chronic stage, which is very dangerous and deadly. So let's look at the common types of respiratory disease. We have chronic obstructive pulmonary disease, we have asthma, we have pneumonia, we have tuberculosis. But our major focus here is on chronic obstructive pulmonary disease and asthma. So chronic obstructive pulmonary disease is a progressive disease which characterized by airflow limitation. When chronic obstructive disease sets in, a lot of things happen in the respiratory disease. It have a similarities when it's setting chronic pulmonary disease and asthma. Okay, for instance, when this pulmonary disease sets in, there are a lot of things that happen. There are a lot of hormones are released at this point. Okay, number one, uh, let's look at the cells that release at this pulmonary stage. Sorry, my work has passed. Okay. Okay, let's look at some prostaglandins or hormones that secrete when asthma setting. Number one, if you look at cycloogenase 1, they are responsible for inflammation, which is found in cause 1 and cause 2. Number two, when asthma or especially COPD set in, something happen. bradykinin will release, arachidonic acid will release to cause pain, to cause inflammation. At this moment, those receptors, especially alpha-1 receptor, will release to activate. And when alpha-1 activates, it will cause constriction, which is result to bronchospasm. And the work of alpha, it serves as to mediate smooth muscles constriction. So when the constriction is occurring, inflammation is there, mucus secretion is there, and this mucus secretion is being released, triggered by esophy, and this esophy is being caused by interleukin. Interleukin, it has different types. We have interleukin 4, interleukin 5, interleukin 13, and interleukin 4 is the one that responsible for masses, which is, and also basophil, that stimulate the B cell, which provide antibodies and immunoglobulin E, which play a central role in allergic reaction, including asthma. So what happened here at the interleukin 13 is, interleukin 13 is 5 is the one that will release they will stimulate inflammation, and 13 will cause mucus secretion. So when mucus secretion is occurring, inflammation is also occurring, there's activation of alpha-1, which trigger this bronchospasm to occur. So which characterized by airflow limitation. So at this inflammation and secretion of mucus is occurring, airflow limitation will also occur, because at this moment the patient is trying to breathe, but there's narrow, the airflow is forcing, trying to pass. So at this junction, the patient is trying, like, let me breathe, because oxygen is not going there, because there's already bronchospasm. So there's airflow limitation. Okay. It's not fully reversible. It includes chronic bronchitis, commonly caused by long-term exposure to noxious particles, especially cigarette smoke. People that expose themselves in cigarette is a major cause that can trigger. This COPD and asthma is triggered by allergy reaction. So maybe when you're exposed to maybe smoke, you're exposed to infection, you're exposed to cold, it can be emotion. The way you are feeling can also trigger this asthma. So people that expose themselves to cigarette, it can trigger this chronic obstructive pulmonary disease to occur. And the disease pathophysiology involves airway inflammation, mucus hypersecretion. As I said before, when there's inflammation occur, mucus secretion occur, they will cause bronchospasm, which causes airflow limitation and destruction of alveolar wall, leading to decreased gas exchange. So in asthma, is a chronic inflammatory disease of the airway marked by reversible airflow. So now, in chronic obstructive pulmonary disease is irreversible, while asthma is reversible. Bronchial hyperresponsiveness and episodic symptoms like wheezing, breathlessness, and coughing. It can be triggered by allergies, exercise, infection. and environmental irritant. Maybe you are an asthma patient, you are working maybe in cement industry. In the process, you hear those little particles can trigger asthma to set in. So some, like especially ladies, when you are asthma patient, you are not allowed to be frying some things or eating frying things because a little things can trigger asthma to set in. So you have to take precautions to avoid asthma. I will briefly talk about pneumonia as well, which is an acute infection of the lungs caused by bacterial, virus, or fungi. Streptococcus pneumonia is the most common bacteria cause pneumonia by present with cough, fever, and chest pain, and can be life-threatening, particularly in the elderly and immune-compromised patients. So asthma is also one of the respiratory disease that mostly affect elderly patients. A child can also be affected with asthma. When we're young, our parents tell us that stop sleeping on the floor because they will tell you that bacteria are everywhere, they are ubiquitous. So maybe you can contract any this streptococci bacteria which causes pneumonia. So and also people with immune compromise can, because at that moment their body is exposed. Any little infection can invade in their body system, which trigger this asthma to occur or set in. So let's look at the risk factor of respiratory disease. Smoking, it can be both active and passive. Yeah, if you are a smoker, it can trigger it. Even if you are not a smoker and you are living in an environment where people are smoking, that is why we say it can be both active or passive. Whether you are not the one that's smoking it, but you are living in an environment where people are smoking, it can also trigger it. Primary risk factor for cold and lung cancer, air pollution linked to asthma, exacerbations and chronic lung condition, occupation exposure associated with ILD, which is infection lung disease, and lung cancer genetic. Alpha-1 trypsin deficiency increase COPD, leaks infection. Yes, as I said, that alpha-1 receptor, when it sets in, it causes bronchospasm to trigger this causes limitation in airflow because of pains and mucus secretion. So let's look at the public health impact. Respiratory disease are among the leading cause of morbidity and mortality worldwide. COPD alone is the third leading cause of death globally, reducing exposure to risk factor, increasing vaccination coverage, and improving early diagnosis and access to medication are crucial for controlling the global pandemic. World Health Organization is aware and they know that this respiratory disease is a deadly disease which can kill, which can cause a lot of damage in humans. So they are trying to provide vaccines that can even prevent. Like those vaccinations, they help to prevent you from getting this respiratory disease. It's not really by genetic that you can get this respiratory disease. Yes, it can be to exposure to infection can also cause this thing. Maybe you don't know, you are living in an environment that is toxic, and peradventure you come down with respiratory disease. And again, when you are sick, it's advisable that you should treat yourself very well because allowing your immune system to go down, allowing your CD4 cells to go down, it exposes you to several disease conditions, not only respiratory disease system. So let's look at the pharmacotherapy. It refers to the treatment of disease and medical condition through the administration of drug. It involves the use of pharmaceutical agent to prevent, manage, or cure health issues by targeting specific physiological or biochemical pathway in the body. The pharmacological aspect or pharmacotherapy aspect is trying to tell us or bring us a treatment, the cure and prevention of this respiratory disease. So pharmacotherapy depends on selecting the right drugs for the right patient at the right dose, administering in the right way for the appropriate duration. This approach minimizes adverse effects and maximizes therapeutic outcome. Yes, if you know the right drug, the right dose, the right route or duration, the right patient, it maximizes the effect while minimize the side effects or adverse effects. So number one, the right drugs. The process of selecting the correct medication begins with a precise diagnosis and understanding of the disease. Selecting the correct medication begins with a precise diagnosis. Most people, they don't like doing diagnosing patient. They will just look at the patient and say, okay, this is what is affecting you. This is what you are suffering with. Let's begin treatment. You don't know the precise condition that the patient is suffering for. You don't know the precise stage. Okay, is it at chronic stage? Is it at the IQ stage? So you have to carry on the diagnosis so that be able to detect and know the particular stage so that you begin your treatment. So clinician must evaluate the mechanisms of action of potential drug, their therapeutic class, and evidence of efficacy from clinical trials. Additionally, patient-specific factors such as age, sex, organ function, pregnancy status, and concurrent medication must be considered to avoid contraindications and interaction. You must know the age of the patient, the sex, and organ function. Is the patient, is he a female? Is he a man? Is he a boy? Is he a girl? Is he pregnant? You should be able to know the status. If the patient suffering from other disease condition, you should be able to know when you are carrying on your diagnosis, and it will enable you to know the right drugs and the right dose. Drug is another critical element of pharmacotherapy. The current dose achieve therapeutic level in the body without reaching target concentration. Many people decide to give drugs without knowing the weight of the patient. That is why you should be able to understand the weight, the body weight. That each drug have milligram per kg. Okay, this man is weighing 30 kg. Okay, let's calculate. This also drug start from 20 milligram per kg to 70 milligram per kg. There are some drug like artemether, maybe like alpha beta, which is 225 milligram, 225 milligram. It's expected that anybody that is taking it should fall under 70 kg body weight before you can be able to administer it. 70 above. 70, sir, time, sir. Okay, okay. So monitoring and adjustment. So you should be able to know the right uh, dose, route of administration. Is it IV? Is it intramuscular? Is it subcutaneous? Is it sublingual? You should be able to know all these things. And in treatment, you should administer your control medication such as inhaler, corticosteroids. You should be able to administer it, relieve medication, short-acting beta Agonists provide quick symptoms relief. You should be able to educate those patients. Inhaler techniques, how you can use it. Signs and symptoms I already mentioned. You should be able to know them and tell the patient that, okay, this when something is happening, this respiratory disease is something that we should organize a seminar and tell people that whenever you are having this kind of signs and symptoms, you should be able to know that this is respiratory disease. And in conclusion, asthma and COPD are both chronic respiratory conditions characterized by airflow limitation and breathing difficulties, but they differ significantly in causes, progression, and treatment strategy. Asthma is typically a reversible and variable airway inflammation, often triggered by allergies or environmental factors. So, as an asthma, you should be able to avoid some environment because it may trigger asthma to set in. Thank you all.
Thank you very much.
Thank you, sir.
Okay. That was a wonderful presentation. I want to appreciate you for the presentation, even though we cut it short because of time. Actually, before now, we let everybody to just talk, but notice that if you talk like that, we're not able to achieve anything. And we still have a quite number of students to present. I like how you missed. You missed. You know, he started by telling on the difference between COPD and asthma. The one that is reversible and one that is not. He was a part, he went to part of physiology and how the inflammatory mediators contribute in asthma. I wouldn't go back to what he said again. Now, I want to point out that in your suspect in your suspect presentation, try as much as possible to summarize. Try to get the points so that you will not, because now that you publish the viewers will miss the information, but try as possible. Okay? So what you do, and also try to be when you were explaining the physiology of asthma, you chronologically arrange. You will repeat some point of the very time. It's a sign that you not actually articulate it. So before the next one, what if you just articulate the points from the report? You have already submitted your report. You have sent a report. Just articulate the points. Make it handy so that you can. And I love the way you look at your work and explain. That's what seminar presentation is all about. You look at the points and explain. But if you are explaining those points like that, within 10 minutes, you have gone through your work and explained the points. Once more, I thank you for this presentation. Thank you very much.
Thank you, sir.
And God bless you.
Thank you, sir.